the final one, just another example, reorienting health services. So for us, we got a sudden shock into this. We had 1 week, 40 degrees, over 40 degrees each day for 5 days. And since that week, we have gone, our health services have totally reoriented the way we are looking after our complex and chronically ill people. We ring them up, nurses ring them up before a heat wave is planned and ask them, you know, what have you got planned today? Maybe not such a great idea to be, you know, going out and doing X, Y, and Z. Probably better to stay put. Make sure you get some, you know, you've got enough fluids, etc. If they're heart patients, cardiovascular disease, make sure you just have lots of ice. So we have also opened up our health services to people who are seeking cool refuges in the health service. So it's, you know, we've kind of reorienting a lot of things we do. So the power of that was, again, to give health promotion practitioners a framework that they could start planning what would they do with local populations for climate change. So I've just got up there a couple of actions that we're doing, and I'll mention those in a minute as we go to talk about our local community work. So the document was published, as I said, assisted by University of Melbourne. It's caused a great deal of interest because it's something that gives people a practical guide. Policymakers, not just within health, but in our local municipalities, in our departments of environment, a range of people are using it as a framework. What we then did is we were keen to work within a local community and start to do some research and action about, well, how will we start assisting communities to adapt? So this is the town we've been working in. It's got 180 people. There are 80 households, 80 homes. It's half an hour from a major town, so half an hour away really from services. It's got a post office, a general store, a pub, a primary school. So what we wanted to do, we really wanted to try and increase the community resilience and the capacity for that community to adapt. And we've focused on energy efficiency and their housing. And why did we do that? We did that because our goal, you can see up there, our goal is not to educate them about climate change or to convert them to climate change. In actual fact, we haven't mentioned climate change. We've gone into that community and talked about, you know, that heat wave, it's getting hotter in some of your homes. We'd like to, and we clearly didn't announce it like this, but our gig was to go in and start looking at these weatherboard, very poor condition homes and working with the community to adjust that, work on that. The home clearly is a great way to start. What's the most important thing to somebody? It's their home, yeah? The other reason we were really keen to work with people in homes is because we knew, I luckily was at a forum where the Federal Minister for Environment and Climate Change had just announced that the first thing they would be doing was to be working with energy efficiency in homes across the nation. So I thought, fantastic. What a great way for us locally to gear this community up and be ready for national policy and national incentives for people to be able to adjust their houses. We've also been looking at some of these other things, particularly service access, but interestingly, that's been a real challenge, but I'll talk about that in a second. So I really want to just touch on the process. So really what we wanted to do was have a community conversation. So we've had a community development project officer who's been working in this community for a long time, since July 2008, and she's done two things. First of all, she's really spent about 5 months just working and that'll be her now, working with the community and getting to know the community. So first week she went in there, she said, what do I do? I said, nothing, just go in and talk to people. What do I say? Just ask them questions, just get to know them. You know, just have a cup of tea, do whatever you like. She said, what if they ask me what I'm doing? Don't answer them, just get to know them. That's a very uncomfortable position to be in, isn't it? She turned up, she opened the door, got out in the main street, looked around, all the boarded up shops, there's no one there. And she said she just wanted to dissolve. So she came back. It was awful. I'm not going back. I said, yes, you are. Go back again. 2 weeks' time, I bet you'll come back and you'll start to tell me all the interesting people that you've met. Well, that's exactly what's happened. She has become part of the community. 2 weeks later, she said, I'm running the walking group now because someone was sick and they couldn't run the walking group. So they rang me up. Jo, are you coming this week? Could you just walk? I said, fantastic. Because as she's running the walking group with some of the oldies, what a great way to chat. So Jo's just become a person that's working with this community. No great announcement of what she's doing. She's just getting to know what their needs are and getting to know them. So what we decided to do, we met this fantastic environmental engineer, and he introduced us to these eye buttons, which are very small. They're a data logger, and they measure temperature. So they just measure, we can locate a data logger in a home and a data logger outside, and we just compare the temperatures. So we have, you see the red line up the top, the horizontal red line? That's the upper zone of human comfort. So that's about 27 degrees. The blue line is the lower level of human comfort, which is about 18 degrees. That's our target range. That's where we'd like people's homes, the temperature to be hovering in between those two levels, ideally without heating and without air conditioning. That would be the ideal, because that's affordable, isn't it? You know, that's protective of the health and environment. So you can see these two graphs below it. The I button is the bright green. So you can see the temperature as this is just over a day. You can see how that you know, it's not a terribly changeable season when we're measuring it. And the red one is the I button, is the I button measurement in the house. So green is outside, red is in the house. And you can see that if it goes up outside, inside temperature goes up. So what do you think is happening in that house? Not insulated, I would suggest. Yeah, it's got lots of gaps. It's because if it's getting hotter, so is the house. If it's getting colder, so is the house. So it's probably got lots of gaps, not well insulated, etc. Hines, our environmental engineer, he has built himself an 8-star energy efficient home in Hamilton, and you can see that the blue graph is the change of temperature externally. So look, we go down to -1. That's cold. That's winter, middle of winter. And it might go up to 16 or 17 degrees. See how that, so we've got fluctuating graph. His house hovers beautifully, doesn't it? So it's not, it's staying literally, you know, between just under 15 degrees and 21 degrees. No heating, no cooling. So this is winter, and he doesn't heat his house. So that's a lovely example of what we'd love to be like. And this is another graph from one of our houses in our town. And again, you can barely see the difference between the inside temperature and the outside temperature. What worries that about us is that if we've got people living in those conditions with chronic illness, who are elderly, unable to thermoregulate, that this is really bad news for them, particularly if we're getting increasingly hotter conditions. Hines would say that even if you do everything right, most people, the gaps in their floorboards, under their doors, actually between the floorboard and the wall, it's like having a window, one window in the house open. So you think you can be doing everything, shutting everything up, but you've actually created, you know, there's enormous drafts in most people's houses. So the lovely thing about this project is that we've got very cheap interventions. What's the intervention? The intervention is to fill up gaps, seal your gaps. That would be number one, Hines would say. And the second one would be certainly insulation. There's also incredibly affordable double glazing now in Australia. So we're not double glazed, you know, in Australia. And there's almost like Glad wrap that you can put over your window and then heat seal it on. So the lovely thing about this is we've got techniques that straight away will shift those houses, and they're very, very affordable.